Thanks to the organizers for this platform and Madam for that kind introduction. So at the very outset, a disclaimer, this is actually the pitch that was shared. So, and our CEO is not here to present it, so forgive me if I'm a bit rusty with some of the jargon. But yeah, I would like to talk about our story. I mean, it's been a very inspiring few hours, so much of knowledge sharing, excellent speakers, a lifetime spent slaving over problems in the hope of providing solutions. Okay, so our area of interest, right? Actually, as Madam already mentioned, I'm a pathologist by training, and I trained extensively in the UK, where I had first-hand experience of the extreme success of large population-based screening programs. In the Western world, cervical cancer has practically been decimated. So the dream, when I came back more than a decade ago, was always of being part of some large population-based screening program. And this was one of the, I must say, pivotal moments in actually in the starting of our journey with Vyuhaa Med Data. So as we all know, cancer diagnostics is pretty skewed worldwide. The well-developed countries have access to cancer screening, whereas obviously the less developed countries have a very abysmal access to screening, which is why our incidence of some of the potentially most preventable cancers, such as cervical cancer and breast cancer, are still very high. So this map shows the cancer incidence across the world, 20 million in the year 2022. So at Vyuhaa, our aim was to democratize access to cancer diagnostics by leveraging technology. So how do we do this? Our first use case, of course, is the AI algorithm we've developed for cervical cancer screening based on the extensive data set that a clinical partner provided. With the confidence that we have gained working on the cervical cancer screening module, we have now started work on additional foundation AI models, again, because we have access to large data sets. So currently, we are starting work on oral cancers, breast and GI cancers. And also, we have gone beyond just being an AI software creator to an end-to-end provider. With our partners at IIT Hyderabad, we have developed a low-cost scanner, digital scanner. So the idea is that each AI module will be embedded in our own hardware, and it will be provided as a one-stop solution. And then we are also in the process of integrating other aspects of reporting itself. There'll be a seamless transition to cloud-based reporting, as well as access to insurance claims. What are the components? Like I said, foundational AI models, edge-based hardware, modular lab units which can be deployed in the field, and access to a hybrid cloud stack. So currently, two pillars. One is population-based screening, which is what our current AI algorithm does, AI, and the other one is high-end digital pathology. We are already one of the largest providers of international digital pathology, and we get work from across of the UK. So these are the two ends of the work we are doing. So the idea is to provide large-scale screening through our AI and other similar AI models, and to provide for high-end digital pathology with combined with foundational AI modules for higher-end reporting. So very briefly on how we have value engineered the whole process. Conventional digital scanners cost about 40 to 60 lakhs, whereas ours is at a 6 to 8 lakh cost. The whole idea of bringing down the cost was to work with the government of India and enable screening of the women across the country. So to screen 1 billion women is the scope of our dream. About all the patents that we have acquired, I mean, we are licensed as a Class C device under the Medical Devices Act, and we have several other patents as well. And we have value engineered the whole process, from affordable cervical cancer screening kits to automated slide processing to the whole slide imager to annotations and to enable accredited reporting systems. With our AI, we have achieved in preclinical trials about a 99.6% sensitivity and a much higher throughput. So yeah, in the interest of time, I'll skip the next few slides. So this is a graphic representation of our whole slide scanner. and of a scanned slide, cervical cytology slide. So currently, what are we working on? We are developing on-the-ground dark labs. This will be digital hubs, which will be populated by our own technology, our scanners, and the AI models that we are working on. Just a brief anecdote. We are working closely with ICMR, and very early on, they were suggesting that as soon as the validations are over, at least for cervical cancer screening. Now, bear in mind that this is just a screening test, so we don't require that level of accuracy that you require with a diagnostic test. So very early on, ICMR suggested that we just get rid of the pathologist, right? So the validations are on with the ICMR, and hopefully by the end of the year or sometime during next year, our ICMR validation should be done. And then we are hoping to work with the Government of India on large-scale screening programs. So similarly with our other foundation AI models, we are hoping eventually that a lot of low-level work will be able to will be done by the AI, and only more complex cases will require pathology intervention. Briefly about our team. Krishnamohan Reddy is our technical director, over 3 decades of experience in imaging and optics. Mr. Madhusudan is our business development head. Professor Renu is a professor at IIT on, again, 3 decades of experience in optics. So thank you for that hearing.